now we'll be taking the next presentation by Dr. Chip Eberechi C. Uko. Dr. Eberechi C. Uko is the head inspectorate division of the Nigerian Health Insurance Authority, NHIA. She is a public health physician and the deputy director at NHIA, where she provides technical leadership on quality management for health systems and strategic purchasing reforms. She also spearheads initiatives for financing cancer care, including the NHIA Roche cost-sharing arrangements and other efforts to advance equitable access to cancer care for all Nigerians. So she's the right person for us to have on this call. Dr. Eberechi Uko, if you're on the call, you have the floor, ma'am.
Hello, good evening, everyone.
Okay, good evening, welcome.
I don't know, can you hear me?
Loud and clear.
Yes. Good evening. My name is Eberechi and I've already been introduced. So before I start off, I'd like to thank Victor and Modupe for the work they've done, putting all this together. It's coming at a really, really opportune time when we are now beginning to realize that the burden of cancer in Nigeria is more than we actually thought. Of cancer patients, cancer survivors in Nigeria. Okay, so I'm going to go over my presentation. It's a very short one, and what I'm hoping to do at the end of this presentation is to make us all aware of the kinds of options that are available for cancer care in Nigeria as of today under the National Health Insurance Authority. So if you just help me advance the slides, that would be wonderful. Thank you. Okay, so my presentation has this outline. We're going to just do a brief background. I'll talk about the scope of oncology services covered by the NHIA. I will also give you a summary list of cancer types that are actually covered as of now, and then discuss our financing approaches and what are the options for those who want to benefit from the services on the NHIA. I will also make us aware of the exclusions and limitations to care that exist as of today, and we'll talk through what these implications are for ourselves, for policymakers, and for the future of cancer care in Nigeria, and then we'll conclude very simply. Okay, as a background, we all know about the burden of cancer in Nigeria. And in case we don't, it's reported to be about 120,000 new cases every year. And for me, that's not even the problem. The issue there is the mortality rate that is really very high. We've been recorded to have about 80,000 deaths every year from cancer, from different types of cancer anyway. And what are the reasons for this? The first thing is poor access. Ronsi made, in his presentation, he made us know that there was a time when there were only 2 centers in Nigeria. I mean, it's better than that now, but access is still relatively poor. And even when patients have access, there is that tendency that they will present late, maybe when the cancer has already progressed to a certain stage. And when they do present, when they have found the hospital where they can actually access care, the next thing is the cost of treatment. So cancer care is really very expensive. For us in healthcare financing, we refer to it as a catastrophic expenditure. So NHIA is at the forefront of providing financial access to healthcare for all Nigerians. No one is exempt. And with the Act of 2022, it's actually now a mandate for NHIA to make sure that every Nigerian has health insurance. And how we shield Nigerians from the hardship of the catastrophic cost of illness is by pooling risks together. And the aim is to improve the affordability and the equitable distribution of services among Nigerians and also enhance accessibility to care. We cover a range of oncology services, and those are detailed in our medicines and procedures price list, which is already out for public consumption. So the scope of services covered for oncology, comprehensive cancer care, you need to have access to a range of services from screening all the way up to palliative care. And NHI covers a range of those services. We do have screening services that are covered from tumor marker assays to fine needle biopsies, histopathology, and imaging services. These are covered. We also cover surgery for cancer. So if a patient needs to have a tumor excised and maybe also the accompanying lymph nodes, those kinds of surgeries are actually covered. We have medicines for chemotherapy. We do have a few of the targeted immunotherapies and also some hormonal drugs that can be used to treat cancer under NHIA. We also have radiotherapy on the list. It's a partial cover, meaning that the patient also gets to pay some amount for the service, but it is on the list and is covered by NHIA up to a cap of 400,000 naira. And then when, of course, because during care, cancer patients can still experience other illnesses. There might be infections, there could be diarrhea, there might be vomiting or even pain. So those things are also covered under NHIA to a large extent. Okay, so this is just to give you some examples of the services that are actually covered. It's not an exhaustive list, but it speaks of the most common things. You can see things like PSA are on the list. We have CA125 and a lot of carcinoembryonic antigen are also there. Alpha fetoproteins. We do fine needle aspirations and biopsies of every kind. For surgery, just as a list, you can see mastectomy, prostatectomy, a lot of surgeries for gynecological tumors are covered, and then also other craniotomy for brain tumors as well. And for the pharmaceuticals, these are just a couple of drugs. I didn't put a very exhaustive list. For radiotherapy, we've already discussed that in the previous slide. And then supportive care includes things like transfusions, ICU, pain control, etc. And by cancer type, here's a list. And if you look on this list, you'll find that the most common cancers in Nigeria are actually on the list. We have breast, prostate, cervical cancer, colorectal cancer, ovarian cancer. So there is a range of coverage for all of these services. Can you advance, please? Yes. Okay, so what are the options that are available under NHIA for persons living with cancer to participate? There is the option to enroll into existing programs like the formal sector health insurance program, which has been implemented for a long time, and is usually for those who are in the employ of the government. There's also GiveShip. Which is for those who take up health insurance on their own, for groups, for families, and for individuals. So these programs actually provide access to all that we've spoken about earlier that are covered under NHIA. We didn't stop at that because there really wasn't so much we could do with contributions alone. So we started looking at having innovative financing access programs, which would expand the scope of services a little bit. And one that has really stuck out and been successful is the NHIA Roche cost sharing for oncology care. This is a program that is specifically targeted at breast cancer patients. And what we did was to negotiate a price and bring on board Roche molecules for our enrollees to assess. And then there's still other things that we're working on, some special intervention funds that we're looking at setting aside a special fund for catastrophic illnesses. And this includes cancer, as well as end-stage renal disease and other catastrophic illnesses, so that we will always have a fund that is sustainable to meet the needs of persons who fall into this category. Please advance. Thank you. So with all that we have said, fortunately, there are exclusions and there are limitations. And the reason why there are limitations is because the resources are not inexhaustible. We actually are working with slim budgets every year. And we need to be sure that at least we can push the cancer patient as far down the journey as possible. So one limitation is the fact that there is still that burden of cost sharing. The patient is still paying something, even though maybe not as much if we're paying completely out of pocket, but there's still that obligation to pay some contribution. For the immunotherapy molecules, the access is kind of limited because, well, initially we started off with only 7 facilities. We've actually spread that project so that we now have 22 facilities, but then again, it has restricted the kind of access that patients would have to those molecules in the first place. Another limitation is the cap on the radiotherapy. We're working towards expanding that cap once funding comes in, so that we can see how much more we can bear for radiotherapy costs. Drug availability is also an issue. Thank you. Drug availability is also an issue because we really, in Nigeria, have little access to drugs. There are some drugs that have not even made it into the country yet. But we're also working with some other partners to see how we can expand the molecules that are available for cancer patients in country. And a total exclusion is bone marrow transplant. As of now, we are not yet able to cover the cost of bone marrow transplants, but where we're hoping to get to in NHI is a place where we can provide access to as many services as possible. Okay, so our approach to expand the service cover is really very simple. We've been partnering with oncology pharmaceutical manufacturers to make sure that medicines access can increase, and we can ensure enrollees or persons who are also partaking of these programs of the quality of the drugs. We are also interested in advancing screen and early detection because that is one sure way to ensure that we catch the cancer early and at a point where it is treatable. So we have screening services on the benefit package already, but we also are interested in working with NGOs and program managers that are carrying on screening programs across the country. That helps us to have an idea of the actual burden of cancer. Structure to ensure that we have to make sure that there's availability of comprehensive services and also that the care is coordinated. But by and large, you find that there is a lot of room for expansion. There's a lot of room for improvement, and we're looking to do just that, to expand and enhance the access to care. So from where we are, where Nigeria is at and where NHI is at, what are the implications for policy? It means that we need to find a way to integrate more information, integrate data from cancer registries, integrate data from outcomes monitoring. I liked what Ronsi was saying about his papers, and it's good for us to also know what research is saying before we make any more advancements. We must find a way to be able to implement, learn from the data, to learn from research, and to also implement programs that will ultimately improve the outcomes. It's also important that we, as a people, as Nigerians, begin to understand the importance of screening and early detection. We need to be able to make people present themselves for screening and encourage people to know their status on time. It actually costs less when you're treating cancer in the earlier stages than when it has metastasized to other organs. It also means that we need to work harder to negotiate pricing for high cost molecules. In a lot of climes, there are a lot of programs where some of these molecules are even available at research institutes for free. So if until Nigeria gets to that stage, what we can do is to continue to negotiate with the pharmaceutical companies to get these prices down. Also, there is a need for us to work closely to expand the radiotherapy and chemotherapy cover so that more people can have access. I've seen some questions flashing about leukemias, about childhood cancers, and yes, they are covered, but the extent of coverage is where we are still grappling with. We need to enhance that. And then also we should also look at palliative care and supportive care after the treatment. So we have cancer patients who are in remission. What can Nigeria do for them? What should we be thinking about doing for them? Kindly advance. Okay, so at the end of the day, what are the key takeaways from everything we have spoken about here? One thing is that most cancers, a lot of cancers are covered by NHIA. We have breast on the list, cervical, prostate, we've got lymphomas, CNS tumors are covered. A lot of their molecules, the medicines used, 5-fluorouracil, the cispoplatins, the chloramphenicol, the Plaxico, well, the drugs are there. Let me not bite my tongue because I don't remember everything. And then the coverage actually spans. We have tried to ensure that we can provide some elements of comprehensive care in the package. But we are not satisfied with where we are. We are still working to push for innovative financing models that will expand the scope of services that patients have access to. And in everything, we see that there's opportunity to continue to scale up. So even with Project Pink Blue, the opportunities to learn from them, to leverage on the experience they have, especially with patient navigation and support, to see how we can expand the care to expand cancer care and have more survivors. So these are just the references. We can advance the slide. Yeah, so this is our parting shot, and we say that together we can make cancer care more affordable and equitable and accessible for all Nigerians being the operative word. And I think with that, I have come to to the end of my slide. I think there's just one more slide if you'd advance. Yeah. just to let you know that we have your back and we're looking towards expanding access and ensuring equity. Thank you very much for your attention, and I look forward to speaking more in the Q&A session. Thank you.